I'd like to just invite Katrina, who we heard from earlier, to share some of her own thoughts and experience about how Interior Health, her organization, is navigating some of these issues. Katrina, on to you, and then we'll take questions. So please, if you do have questions, please do start sending them into the chat box, and we will take them when we hear from Katrina.
And I'll be pretty brief so that we have a bit of time for conversation. But I think Annette's example really resonates with my own experience in our work here at Interior Health. But I can comment just from more of a higher level organizational perspective and the kind of health equity work we're trying to do. So I've been working with a really lovely team of people for a few years now on trying to integrate an equity lens into several different areas of our organizational work. And the particular experience that we've been working with the National Collaborating Center for Determinants of Health with was integrating an equity lens into epidemiological surveillance practices for opioid overdose. And so I think that the ideas about safety and leadership and what we can do as an organization are really so important in that project, because we were really trying to work with a team that had very good equity intentions, but we're working also within epidemiological frameworks that are fairly established and have particular ways of working and doing and thinking about data and thinking about what counts and what we pay attention to. And over time, and through having a very supportive environment where we had endorsement from multiple layers of leadership across the organization, which was really critical to being able to create a safe and invitational space to talk about really difficult topics of power and privilege, and how those sorts of things influence the way that opioid overdose is even considered. So for example, as an isolated event rather than as something that's happening along a much more complex trajectory. So I will just say, I think that finding ways to create that invitational space is really a critical facilitative skill that is needed for teams to be able to have those very difficult conversations that are, and those dialogues that are critically reflective, but not critical of people who probably do have good intentions, and people tend to get caught up in defensiveness if they feel like their virtue is attacked or their values are somehow being attacked, which is not also the intention of sparking really disruptive conversations. But I think that there's ways to facilitate this that feel more safe and inviting for everyone, and that don't inadvertently portray a sense of elitism or exclusion because someone needs a little bit more time to understand the ways that power might be working. So I thought one of the examples, I think it was Vanessa offered an example earlier. It's very difficult sometimes to have conversations when people don't understand or can't really, where their values or their worldview makes it difficult for them to see how structural factors might be affecting the way that society is organized or the way that health equity work needs to unfold. But I think there's ways to do it that are much more invitational, and having that endorsement from leadership and creating really safe and comfortable spaces where people aren't judged or shamed for what they say, but rather that we can use that as a way to understand and explore the way that different stories have shaped the way that we see our world, can really play a big role in shifting us towards a safer and more productive conversation. And that has certainly been, we've just seen a lovely trajectory in Interior Health, where this one project has been just now one piece of a much larger equity agenda that's unfolding across the organization. And the last thing I'll just say is that I think it was interesting in the poll to see where health equity work was happening. And I think it's so important and powerful to start with that very good intention. And then I think moving into action requires a lot more tools and skills, and having safe environments to engage in this dialogue is one of them. I think the examples from the Equip Healthcare projects have been amazing.
Great. Thank you so much, Katrina, for sharing your experience at Interior Health. So thank you both, Katrina and Annette.